Tumor profiling allows us to provide personalized care for oncology patients. We take a patient's biopsy or their cancer tissue and we send it off for genomic profiling or genomic testing, which is basically DNA sequencing of the tumor in order to know what mutations are in the cancer. This is important because for particular mutations, we may have a drug that targets that mutation, and that drug may actually be a more effective treatment than traditional chemotherapy. We may also find mutations that predict that that patient may not do well with traditional therapy, and for which there may be other better options available for that particular patient. One of the examples I can share is a patient of mine recently who I met with lung cancer, and the patient had a resection of her tumor and was supposed to undergo chemotherapy. But we sent off the tumor profiling and she had a mutation for which we actually were able to provide her with a drug that targeted that mutation, and it was a once-a-day pill that she had to take. So by doing this test, we were able to avoid chemotherapy in this patient and provide her with a more effective and less toxic treatment. The future of tumor profiling is that it will eventually become cheaper, easier, and quicker to do this testing. Also, by finding new mutations, we'll be able to identify new targets and hopefully be able to provide new drugs and more effective treatments for patients in the future.